There are over 2.65 million carers across Australia. That's 11% of Australia's population. Carers contribute almost $80 billion worth of informal care. That's 40% of our current health system expenditure of $195 billion per year. It is clear that carers are a critical component in maintaining a functioning and healthy society. They devote their time and energy to the ones they love, and in so doing, alleviate the burden of care from the health system. The carers do this at a great personal cost. Not only do many carers feel invisible, unsupported, and overburdened, but their health and well-being suffers under the relentless strain of being 24/7 carers. There's no respite, and the support is haphazard and inconsistent. Their partner or family member is unwell or has a disability, or they have a mental health issue, and so they do what any loving and responsible person would do. They care.
I'm still in the hole, trying to dig my way out, and the two people that are supposed to be helping me are also ignoring me. It's just a thank you for all the good things about Tess.
Name one of them.
Serenity. Wisdom. Support.
I met with Kingborough Council and Carers Tasmania and proposed we create a pilot program designed to care for carers. The program we developed together was called More Than Carers. Tess Fletcher ran mindfulness meditation classes, and then after lunch, I facilitated a session of drama games. The mindfulness centred the participants, and the games gave them space to play and create.
I was a textile artist, so I used my sewing needle as a little brush. So this is one of the things that I did in my early days as a textile artist.
The more that you recognise yourself as a being as opposed to a carer, that she's able to see and recognise that as well. Do you think that's part of it?
Yeah, I think so. I think so. Before, she'd say things like, I don't know what I'd do if you got sick or if you died. It was only because that she would need a new carer. But now it's not that. She seems to be more genuinely concerned. So, I like these new changes that I've seen.
Through this process, carers were encouraged to share what they were going through, and then, when they were ready, we sat down, chatted, and we made this film.
Before I was a carer, I was a nurse, but not a nurse who knows anything about medical issues or geriatrics or dementia. I was a theatre nurse, an operating room nurse, and I really miss my work. I was thinking about that this morning. That the thing I miss is that being an operating room nurse, you get to work, you know what the theatre list is, the operating list is going to be, you get ready for it, you do it, you clean up after it, and it's done. But with caring, it's never done. It just goes, it's a constant. It goes on and on and on. And although it sounds weird, I've found it really hard to adjust to that. And I wasn't prepared for it either. I came back from Broome. Dad wrote to me and explained about Mum's dementia and asked if I'd go and see the gerontologist with them. And I went back and resigned. My plan was to work 4 days a week and then take Mum and Dad to Bruny, which is where they live, for the other 3 days. But it didn't pan out like that. Mum got worse. Dad had some major surgery. My plan didn't work out, and it just turned into a full-time caring role. With Mum with dementia and Dad being frail-aged, it's a whole new world. So especially with dementia, the key for me was education. I did the MOOC course regarding dementia, and I just took it from there, and I went to every piece of education that was provided, and I found that really, really useful.
I ended up studying the concept of combining disaster reduction and poverty reduction, so that after the disaster, people could then keep the resources that were used there and perhaps turned it into more permanent housing. It's made out of an alternative building material, cardboard. I ended up taking the whole project to India, and I spent 6 months over there showing various sectors of industry and society this particular idea. This project was going fine. It's a long process, and it requires 100% of your energy. But when I came back from India, I had to spend more and more time on care, and the project has been mothballed. Kate has a special form of, a rare form of dementia called FTD, frontal temporal dementia. Well, she started off needing so much care that she couldn't live at home. So she had about 3.5 years where she wasn't at home. I thought she only had months to live, I would say, if she had stayed in that situation.
So how long has she been home?
Well, we're in our 3rd year, so it's amazing.
And how would you describe her health now?
She's actually healthier than me at the moment. So the problem's not her health, the problem's my health.
Well, we both went to a lunch, and it was on a Friday, and when we got home I said I don't feel very well, and by night time I went to bed pretty early, but I was feeling really sick. I was vomiting and had the trots, and I was up and down all night, so I got very little sleep. Saturday morning I got up as usual and got my husband's medication, made his breakfast and went back to bed, and only sort of woke up when my tummy rumbled and I had to run to the toilet. But by night time he'd recovered, but I still hadn't. And then the next day was supposed to be my support worker, and I thought, oh, that's good, because I can get her to help with the washing. There was a lot of washing, obviously, and she normally came at 11 o'clock, and by 11:30 she hadn't arrived. So I rang up and they said it was their policy, if there's an infectious illness, then they withdraw support workers. And I thought, that's really nice. I need it now, and I'm not going to get it. I had to go downstairs, start up the machine, come back up, because there's nowhere to sit. Down the steps to get the washing out and put it on the line, which is difficult for me because I've got spina bifida in my neck. So when I do that, I'm likely to fall flat on my back. I had to do that 3 times and then bring the dry washing up, which, the way I was, having had no food for 3 days, was a disaster. I was in so much pain. I just wanted to end everything. So I'm now on suicide watch.
Son, that's Warren, who lives in Perth. That's Dirk, he lives in Burnie. And that's my wife, Archie. And that's me. You could see that my wife's 8 years older than me, and she just took advantage of me. I was still a young boy.
What a naughty boy. Oh, Tomorrow there will be an advertisement in the paper.
So Dirk, can you tell me what the assessment process was like for Archie?
It was a nightmare. The doctor said that she had to have my aged care assessment done, and I rang the people and they told me it would take up to 2 years to do. I spoke back to the doctor about that. He said that's crap. And in the meantime, Carer Tasmania had a dementia course on, which I went to, and I met Monica from Carer Tasmania there and said, Dirk will help you. And she did. She was so great that the next day, that'll be interesting, the people rang that does the assessment and they came and done it the next day. And then the problem was after the assessment that their computers broke down, and they were broke down for 2 to 3 months. You want a cup of tea? The crap you got to go through is unbelievable. But finally I did get a letter home that she's been assessed for level 4. But to get level 4, we had to wait at least 2 years for people to die to make room for that level 4 package. And in the meantime, she's got a little package out of level 2 for showering.
In 2017, the School of Psychology at the Deakin University released the results of a national survey of the personal wellbeing of carers. What the survey found was that carers had a national average of 58.5. The national average is between 73.4 and 76.4. In fact, of all groups surveyed, carers had the lowest personal wellbeing. The study also found that more than half of the carers reported having either moderate, mild or severe depression. In comparison, the Australian Bureau of Statistics Mental Health Survey of 2017-18 found that 10% of Australians had depression or feelings of depression.
So in the beginning it was 24/7. So 24/7 is you can manage that for a short period of time, but if that grows into years, it's just unsustainable. Well, I'd say emotionally, psychologically, there's a big strain. I am coping, but I have to keep on working at it. I guess it's like there's just so much a koala can bear.
So his health maintains a better quality. But what about your health as a carer?
My health has deteriorated significantly.
So
over the time.
exponentially, would you say?
Yeah. And I also worry about how the system is going to cope if something happens to me. I know that Dad will be, the ambulance people will, if they come to collect me, will do something with him, but I'm not sure what exactly that would be and who would do the things for him that I do.
The more pressure you put on yourself, the worse it gets. So yes, I've got to say it will deteriorate. As I said to you, I've had sleeping problems and I've never had that before. So stress, I suppose, would have something to do with that.
Let's play baseball.
Yes.
I feel like I've been able to say I need help. I'm fiercely independent, but I need help. But he now seems to remember those things that we talked about and remember them the next day. If I grunt a lot, he says, "Are you in pain?" And then in the morning he'll ask me, "Is your pain any better?" so that's really sweet.
And I think it more than anything else that I've been to over the course of the last 3 or 4 years, that's definitely made the most difference, I think. I've really enjoyed it. I've learned a lot, and I've also had fun, which is quite rare when you're a carer sometimes. Yeah.
It's been a good cause. I've had trouble sleeping, and I definitely sleep better since I've been doing this course and the breathing exercises. You feel more at ease, and if things don't work out, you can let go better.
So the problem is if you don't manage your home carer or your own health, then you become a statistic yourself, and would need the carer would need their own package. So that would just compound the problem in a serious way.
There are so many carers working 24/7, caring for so many people throughout the system. If you zip to those people, if those people needed to go into the hospital system would collapse. There just aren't the resources. There aren't enough physical resources, as in beds, etc. There aren't enough human resources, as in staff. It would be a disaster.
Yes, my wife doesn't like leaving the home. She would be better off, and it would be cheaper for the government than if she was in my aged care home.
I need a more regimented form of available respite. I need to be paid more so that I don't have to stress about money all the time.
Yes.
And for me, I need more education to keep me interested, to keep me learning, so that I look after Dad better and myself better. I think a lot of carers are very isolated, and the system should be providing more to check up on those carers.
It's absolute crap if you've got to wait 2 years before you can get a package. I've paid my taxes all my life, and I'm entitled to getting better looked after than what we are at the moment.
If you can just supply enough respite and enough carer support, then things become much more sustainable. If we don't get the carer support, then instead of having one person in need, you might end up having two people in need, because we're not going to give up. We're going to do the care with or without support. So I think the danger is if we do too much, then we'll run ourselves into the ground and end up being hospital cases ourselves.
We're all going to clap at the same time.
We're all going to clap at the same time, and no one's going to say when.
That will impact on community. They will need more resources to put into the care situation. It would soon get out of control. So we can control it more by investing in carer support. There would be a huge return on investment.